name's Jim Duquette. I'm from Claremont, Florida. I started losing my hair in my early 20s. My dad is almost completely bald, and his dad is almost completely bald, and my uncle is pretty bald. So yeah, it runs in my family, I would say. I kind of was in denial at first. Didn't realize it, really what was going on. I never even crossed my mind like that I was losing my hair until one day I started looking at it, and I was like, wow, I lost all my hair. I look much older than I am. So I want to see what I can do about it. And I looked at a bunch of different methods. In 2009, I went to another doctor over in Tampa. They worked on the front, on my crown area, and kind of left the back. And it was full at the time, but I wasn't on any type of medication to keep the hair, and it ended up, I'm pretty much back to square one. I'm hoping to fill in the back, just give it a more overall, just a generally thicker, fuller look. To me, it's just I have a pretty big open spot in the crown, and my hair just has a thin look to it, so I'm trying to get a little bit of a thicker look.
Okay, I'm here with Jim today, and we're just kind of outlining the what we're going to do today. So what I've done, as you can see, is I've drawn out the different areas. Now, Jim's had a prior procedure, and actually the location of his hairline from his last procedure is he's very happy with, and I think it looks very, very natural, and so we're going to keep that rather than lowering it down today. But what we're going to do is basically thicken everything up and reinforce that hairline. So in the very front, we're going to be doing some micrografts of 1 and 2 hair grafts to give you that nice natural look. No plugginess, no doll's hair look. We want it to be nice and natural. It's going to be nice and staggered. We're going to keep it nice and staggered. But mainly we're going to focus on the bigger grafts and fill in these holes. What he's seeing is, he's seeing gaps throughout this hair because he's lost his natural hair. All he has left is grafts. In order of priority, we're going to do that frontal band, and then we're going to really focus on this crown. His crown is the area that needs the most work today. It bothers him the most, I think. So we're going to basically focus on those 2 areas. If we can get an additional strip, meaning that his elasticity will allow us to bring it together real easy, I'm going to go for a 3rd strip and hopefully have enough to connect the dots, meaning that frontal band and the crown will be able to fill in some of this middle part. So we're going to go for it today, and Jim has been nice enough to allow us to shave his head. And I want to let our viewers know that shaving the head has a lot of advantages, and I always recommend it for my patients. It's never mandatory. If you're in a situation where you're able to wear a hat for a week or 2, or you just don't care, there's a no-brainer. That's the way to go. You have a clean field. When you're washing these grafts afterwards, this hair doesn't get in the way or caught underneath the graft and flick it out. However, we do have people that come in that are just unable to shave their head, and for those people, it's not mandatory. We can get through it and get a good result. You just have to be extremely careful with the hair on top. Also realize there's going to be scabs here, and most likely he's going to wear a hat anyway. So if you can do it, that's the way to go. So looking forward to getting a good result, Jim, and
Great.
Let's get it done.
Cool.
Dr. Huebner here, Natural Transplants. I'm here with Jim. So we're about, I don't know, a third of the way through the procedure at this point. He's had his anesthesia, he had strip has been removed, and he's been all sewn up, and I'll show you exactly what we did. But Jim, how's your experience been today?
Good. A lot less painful than I thought it was going to be, and really pretty, a glorified haircut. I mean, it's not, doesn't hurt any more than anything else. So
awesome. A lot of people are scared about the anesthesia, how much it's going to hurt. You know, are you taking my scalp off? You know, how much bleeding is there? Am I going to, you know, be unconscious? You know, we've been watching TV. Actually, we listened to some rock music, talking about Led Zeppelin, Black Sabbath, Ozzy Osbourne. He's been walking around, checking his cell phone. It's been a nice, easy day for us. So we have snacks available, you know, easy stuff. So again, I don't even call it a surgery, I call it a procedure, because that's how easy it is. In Jim's case, we were able to get a full strip in addition to a 3rd strip because of his elasticity. That's even after having a prior procedure elsewhere. So we're really going to load him up today, and again, a later time I'll show you all the grafts that we put in and what the areas we covered and everything else. So I'm really excited. I'm going to bring you around the back here and show you the suture line in the back. Alright, so I want to show you the back incision that we've done. So this is again after taking a lot of tissue out. I wanted to show you how approximated and how small this scar is going to be. So if you follow it around here, we go all the way up here, so it still gives him room to have some recession in the temple, and we came all the way around. You can actually see how perfectly approximated it was and how it is, and that's the key to getting a seamless, undetectable scar in the back. Dr. Huebner here, Natural Transplants, here with Jim. We're about 2/3 of the way through the procedure. At this point in the procedure, the strip's been taken out. Actually, 3 strips have been taken out in the back. We're able to get it back together nicely with a clean incision, which you saw earlier. And how's it been going, Jim? What's your...
Good. Pain-free. I mean, it's been a real simple process. It's been quicker and easier than I thought it was going to be.
Cool.
So I'm feeling good.
Yeah, everyone's worried about the pain, and really very minimal pain. No pain, actually.
None.
Except for the anesthesia part, which is very, very minimal pain. I want to bring you back here and show you what we've done. We've actually been able to fill his entire head today. And they're still cutting more and more. His density was amazing. So anywhere else you go, you'll never have anybody be able to even have the possibility of filling your entire head with grafts with the density that we offer. But based on his strip, the fact that we got a 3rd strip and his density being so high, we were able to get his entire crown jam-packed, in addition to the rest of his head getting some of those density grafts, which will give him those the density grafts he needs. So I'll come in, I'll zoom in here, I'll show you exactly what I'm talking about. So as you can see here, we have a spiral that we've created here, and we basically have the grafts going into a little spiral pattern. So it's not just straight, we actually reproduce and remake his spiral that he used to have. So all these grafts are going to shoot at different directions depending where it is in the spiral. It's very important, it takes a long time to get good at this, but the angles of the hairs are so important in getting that result and getting the hair to lay the right way, and also laying hair the right way is going to maximize the coverage that you have. That transitions nicely into all these grafts in front. We've recreated, or actually reinforced his hairline in the front with tiny grafts, and then being able to come all the way back and connect this all the way through with density grafts all the way into the crown. But you can see his entire head is full of grafts. So we've hit every area, and that's so important for him because he has generalized loss everywhere. He's going to find that this result compared to his last result is night and day. So very happy, very excited about it, and can't wait to see his results. Thank you, Jim, for being such a good person about this and helping people out. And we look forward to showing you his results as they come in.